According to the CDC, 1 in 10 Americans has diabetes.
But treatment isn't one size fits all. Experts say that's because even though two people may have similar symptoms, the diagnosis can be very different.
In this medical mythbuster, Viv Williams goes in depth on the disease that kills thousands each year.
All diabetes is not the same, and type 1 and type 2 diabetes are actually very different, almost opposite in some ways.
If type 1 and type 2 diabetes are so different, then why are they labeled as being the same disease? Dr. Anna Bradley, a Vanderbilt University endocrinologist, says both type 1 and type 2 diabetes have an impact on how your body turns food into energy, which results in your blood sugar levels being too high. But why this happens is different.
In type 1 diabetes, the blood sugar is too high because the pancreas stops producing insulin. And insulin is the hormone that causes the cells of our body to take in glucose or nutrition. So without that hormone insulin, our bodies can't bring sugar from the bloodstream into the cells, where it's mobilized and used to make energy.
Bradley says in type 2 diabetes, blood sugar gets too high when cells become resistant to signals produced by insulin. They stop converting sugar to energy, so the sugar builds up in your blood. Your pancreas responds by making too much insulin.
So the pancreas is working in overdrive to produce insulin to help the body overcome that resistance and respond.
Knowing what type of diabetes you have is important because treatments are different. If you have type 1 diabetes, Bradley says you have to be on insulin because your pancreas doesn't produce it. If you have type 2, she says there are many medications to try as a first defense to help your cells respond better to insulin. But
sometimes in people that have had diabetes for a long time, type 2 diabetes, their pancreas is working in overdrive for so long that it gives out. And so we do have to treat those patients with insulin.
The CDC notes that 90 to 95% of people with diabetes have type 2 diabetes. Bradley says being overweight is a major risk factor because fat tissue is insulin resistant. But maybe that's the good news because in some cases,
if we can reduce fat by improving diet, improving physical activity, that can actually reverse diabetes.
Whether you have type 1 or 2 diabetes, proper management decreases your risk of developing complications such as nerve damage and cardiovascular, eye, and kidney disease. With this medical mythbuster, I'm Viv Williams.
There is a third type of diabetes, gestational. It happens during pregnancy, but usually goes away. Dr. Bradley says it can cause complications for expecting moms, including high blood pressure and an increased risk for type 2 diabetes later in life. For the baby, there can be an increased risk of being born premature and being overweight or having diabetes in the future.